Hello, thank you for joining me today. I'm excited to talk to you about the City and County of Denver's Love My Air program and how we are working to engage school communities, particularly students, using air quality sensors. My name is Aubrey Burgess, and I am the program coordinator for Love My Air Denver. We are housed within our Department of Public Health and Environment. You will also be hearing from my colleague Yvonne Cappel-Vickery later on in this presentation. I wanted to kick off this presentation with a quick overview of the history of air quality and asthma in Denver. Denver, Colorado has the 24th worst air quality among major U.S. cities, and only about half of the residents realize the potential health effects. Denver families spend about $3,100 a year on asthma-related medical costs, and addressing childhood asthma means lost wages for parents who need to leave work to care for their child, increased absenteeism for asthmatic students, and decreased academic performance. Our program operates out of Denver Public Schools, which has an asthma prevalence around 10.8%. That's higher than the national average, which sits around 8%. So our solution to these issues is to reduce air pollution and limit exposure through behavior change, advocacy, and community engagement. Our program is currently sponsored by the 2018 Bloomberg Mayor's Challenge. We were one of 9 cities to receive a $1 million grant to fund the program through 2021. All of our participating schools, of which we currently have 20, receive an air quality sensor that measures fine particulate matter, or PM2.5, that is then relayed to an air quality data platform and a dashboard that sits in each of our schools. But the key focus of today's presentation is really on the co-developed programming and air quality education and how we're working to connect students and their families to air quality data and other resources. We have developed a number of education and intervention programs, of which we developed through focus groups and iterative feedback from school nurses, teachers, and administrators. Our school nurses receive a toolkit that includes tools like placebo inhalers to facilitate discussions with students and their families. Schools can additionally opt into programs like air quality STEM curriculum. Our middle and high school programs include handheld sensors from our friends at AQ Trex to allow students to conduct their own citizen science experiments and collect their own air quality data. We are also developing community-based initiatives and competitions, whether it's a new district-wide science project or having schools and clubs compete against each other to come up with innovative solutions to air quality monitoring and communications. Our indoor day action plans will allow administrators to make decisions about alternative recess or after-school activities when air quality is particularly poor. We have partnered with our Safe Routes to School program to make sure that walking and biking to school instead of driving can be done safely. Our anti-idling campaigns include opportunities for students to custom design their own elements like signage. We also provide schools with the opportunity to host low emissions events where they can substitute generators for solar-powered batteries. And we began implementing these programs last school year, but since the pandemic has started, we have had to reimagine a lot of these programs since schools in the district are currently not operating in person.
Hi everyone, Yvonne here. I will be discussing how we have pivoted the Love My Air program since March due to the COVID-19 pandemic. Prior to COVID-19 pandemic, our air quality curriculum was designed for a traditional in-class setting. However, it became clear that we would need to develop something that students and teachers could use in a virtual world. So, with the help of contractors and educators, we created a completely virtual air quality curriculum. This includes the traditional written curriculum along with case studies, video labs, and we recently added the ability to request a virtual presentation from an air quality scientist specialist. COVID-19 pivot, home-based interventions, and parent education. So, during the initial COVID-19 shutdown, it became very clear that parents have become more involved in their children's education and health than ever before. Through newsletters, social media, and eventually the Love My Air app, we're encouraging parents to take steps to reduce their children's exposure to poor air quality by encouraging using air quality forecasting to make decisions about health and other home-based interventions, such as ventilating while cooking and reducing exercise near busy roads. We are also working to develop a parent guidebook to assist parents in navigating the complex world of air quality and its impacts on children's health. Love My Air app development. We're currently developing a Love My Air app which will stream real-time access to current air quality information, historical data, and forecasting. This app will also include push notifications to influence behavior change and receive feedback from users to refine programming and data communication. The app will also include user reporting tools for submission of information related to things such as user action taken in response to air quality events, complaint reporting, social aspects, and uploading features for user submission of photos. It is our hope that this app will increase engagement and education in a remote world and facilitate easier access to air quality information and education from the Love My Air Air Quality Sensor Network. What's next for the Love My Air program? We will continue to incorporate community feedback to continue to evolve the program for a COVID-19 world. We will scale up to 40 schools in Denver by 2021. We will launch the Love My Air app, as mentioned previously, and increase replicability in other municipalities through a no-cost licensing agreement and the Love My Air Replication Toolkit, which I will explain in further detail in the following slide. When we began the Love My Air Denver program, we wanted to create a program that would be easily replicated in other areas, in other cities, or around the world. So, to make this program replicable, we created a Love My Air Replication Toolkit and a no-cost licensing agreement. The Love My Air Replication Toolkit will provide all necessary information to launch the Love My Air program in other municipalities and increase the impacts created by the Love My Air program design. The Replication Toolkit includes engagement templates like social media campaigns and all the necessary tools to deploy a school-wide anti-idling campaign, for example. The Engagement Toolkit also includes newsletters and PSA templates. It also includes a visual design element with a rack card and infographic. The Replication Toolkit also includes a public health toolkit, which provides a school nurse toolkit and an education toolkit, which includes the air quality curriculum for kindergarten through 5th grade students mentioned previously. The no-cost licensing agreement will grant access to all Love My Air logos in Spanish and in English, as well as in various formats such as JPEG, etc. The no-cost licensing agreement will also provide access to the Love My Air network. Entities will be able to idea share with other municipalities involved in the Love My Air program. This is intended to expand the impact and provide helpful resources for all involved. One entity has already started using the Replication Toolkit in rec centers. As more entities replicate the program and enter the no-cost licensing agreement, we hope to refine and expand the resources available through the Replication Toolkit. A high-level outline of the Replication Toolkit will be available very soon on our website, lovemyairdenver.com. We look forward to hearing your feedback about the Replication Toolkit. Thank you for joining us in this presentation today. We look forward to answering your questions and comments about the Love My Air program.